Hello, everyone, and welcome to this episode of Let's Talk About Health. I'm your host, Madeline Mant, and I'm privileged today to introduce our guest, Rebecca Ripco, who is here to tell us all about her work as a social worker. So welcome, Rebecca.
Hi, everybody. Thanks for having me.
So, Rebecca, what does a social worker do? I know this is a loaded question, but what does a social worker do in a general sense?
Oh my gosh. So social worker, it's actually a very broad career choice. So a lot of times when we think of social work, we often will think of maybe somebody doing one-on-one counseling, or a lot of times people think of Children's Aid Society and children protection workers. Sometimes we think about the social workers that we meet at the hospitals, but those are just some of the various careers that a social worker can take on. So for myself as a social worker, I've chosen to go the route of addictions and mental health. And so what I have done over my career has varied between one-on-one counseling, leading therapeutic group treatments, and case management, which is the role that I'm working in right now.
Okay, so what does all that mean? What's your day-to-day look like? Because I'm super interested in it. And I think I also have some preconceived notions over where I think a social worker fits in, which might honestly be coming from movies or something like that, or hearing when somebody's intervening. So what's your Monday to Friday look like? Or maybe is it Saturday to Saturday? Or what is your schedule?
Yes. Well, I'm lucky that I did get a Monday to Friday job. So as you can probably imagine, people who are needing help and support, crises don't take the weekend off, or they don't take holidays off. And so there are a lot of social workers that do work varying shifts. Maybe it's evenings, weekends, but a lot of us do work sort of what you might consider typical office hours, Monday to Friday. Sometimes we'll also work into the evenings to support people who are also working Monday to Friday, 9 to 5. So I actually just started a new job about a month ago. And so I'm excited because I get to talk about it. Right now, I am a social worker in a hospital, specifically working in mental health. And my role is as a case manager. So my role is to coordinate a lot of things for the people who are accessing support, specifically for, I work with patients who have schizophrenia right now. And so this could be coordinating some basic thing, what we might call the basic needs, coordinating housing, do you have food stability? It's ensuring that they have access to their medications and that they're able to take them on time. Maybe it's coordinating things like taxi and bus services. Kind it's supporting them with referrals to bring them to an employment counselor. If they're looking to maybe start volunteering, kind of go for a vocational route, that type of thing. And it also involves getting to work with the psychiatrist, which is kind of cool. So supporting people with, are your medications working for you? Are the other things that you're doing for your health working for you? So it's quite varied, but it's a lot of fun. Before that, I was doing more of a one-on-one counseling for people living with problematic substance use and mental health. So it would actually be kind of your classic one-on-one session. Folks would come into the office and we'd meet, we do an assessment, we develop a treatment plan focused on the goals that they want to achieve. And I was working from what we call a harm reduction focus, which means the person doesn't need to necessarily stop all of their substance use, but maybe they want to change the way that they're using, or the method, or the quantity.
Okay. This sounds incredibly rewarding and really, really varied. So I just want to ask another follow-up on that. You're talking about some of the one-on-one versus maybe more like group work. Is that what I'm hearing?
Yeah, so there's a lot of different ways that people can receive treatment. Often we think of, typical therapy, you go in and lay on the couch for a while, which is actually not what I do. Everybody gets a chair. Or sometimes we'll actually meet people out in the community, we can go to their homes, or if they feel more comfortable, maybe like a Tim Hortons or something, sometimes the park, whatever the person is really wanting. I had the ability to do that in my previous role. Your question was around group, though. I got a little off topic there, but so group can be a great space for people who are wanting to make some changes, but also looking to hear from other people on what's working. You can get that social support from them. You can hear someone else say, "I tried this, and maybe this will work for you as well." Also, that just you're not alone. in this. And so often as the group facilitator, we'll be there, and there's different types of groups. There's support groups. So we may be there just to lead as a facilitator and kind of keep the ball rolling. Or there may be more of like kind of a psychoeducational group where we're actually presenting on material and teaching it in a way, and then having the people attending the group take that back into their everyday life and try out some of the new skills they learned.
This is completely fascinating. Now, we're talking about this through a lens of anthropology as well. So we talk a lot in our classes about how we use language and the importance of having really specific definitions around things. And so we talk about words like health and illness, wellness and sickness, and how those can be really complex concepts. So can we touch upon that within social work, within your own context? How do you use words like health and illness?
Yeah, that's a really great question. I think we often hear things, the terms mental health and mental illness, and how those, a lot of times we use them synonymously, but I think that they can be actually juxtaposed in some ways. So all of us are living with varying degrees of mental health, how we're doing sort of on the day-to-day, the week-to-week. And then what we would call a mental illness is something that would be actually diagnosed based on the Diagnostic and Statistical Manual. And so there would be a specific set of criteria that either a doctor or a psychiatrist would have to diagnose. So as social workers in Ontario, we're not able to diagnose, but we can sort of use some of those criteria to sort of see what might be going on for the person in conjunction with their primary healthcare provider or psychiatrist. So in social work, though, we often focus more on a recovery model. We'll focus a lot on the strengths. What does this person have going for them? What are the things that are helping them live their best life despite this diagnosis that they might have? We also use a person-first language. So instead of saying that mentally ill person or that schizophrenic person or that bipolar person, we'll actually say the person who is living with schizophrenia, the person who is living with bipolar disorder, because that helps shift some of the stigma around that mental illness diagnosis is the only thing about that person. It can make it easy for us to forget that this person maybe is a fantastic trumpet player, or they bake the best cookies you've ever had, or their favorite thing to do on the weekends is go play baseball with their friends. A person is so much more than just that diagnosis that they have. And a big part of being a social worker is trying to address stigma in the community, to be doing some of that advocacy piece. There are a lot of social workers that don't even do individual services. They actually just act on a policy level, which is to try to make changes in how we do things here in Ontario and in Canada.
That is absolutely incredible. So for our audience who are watching this and thinking to themselves, well, now I want to be a social worker and go ahead and work on some of that policy and that change, how might somebody actually go about becoming a social worker?
Yeah, there's a few different ways, actually. So to be called a social worker in Ontario, you have to be registered with the Ontario College of Social Workers and Social Service Workers. And they have a few different avenues. They do have some recognized educational programs that you can look up on their website that will basically, if you study that program and then you apply to the college, you will get in. There are other sort of other ways to go about that you can maybe use based on work experience. If, perhaps you don't have a degree that lines up with it, but you want to get in, you can always apply and try. But I think there's two different degrees that are kind of your kind of get in cards, which are the Bachelor of Social Work. So that would be an undergraduate degree. And then the Master of Social Work, which is either a 1 or 2 year degree. The good news for you all who I think are doing probably a BA in Anthro is that you don't need a Bachelor of Social Work to do your Master in Social Work. What I did was I had a BA in Criminology and Sociology, and then I was actually sort of working in the field for a bit, and then I decided to apply and go back. You do need things like reference letters. You do need to I had to write, I think, 1,000-word essay around my experience in the field and what I was hoping to do with the master's and why I thought that would be applicable. And then once I got in, I actually took a course that was for working professionals, and I was able to continue working, and I did my coursework at night and on the weekends. So it took about just under 3 years in total.
Right.
But it was well worth it. I learned a lot. They really teach you a lot about intersectionality. So you learn about when a person is presenting with a certain problem or thing they want to change in their life, it's not just that existing in a vacuum. You have to look at, the person's age, gender, sexuality, their race, their history of experiencing colonization, perhaps as an Indigenous person. And so the social work degree will cover a lot of those types of things and get you looking at the big picture and all the other things that may be impacting that person in their life today.
That is absolutely incredible. Well, I want to thank you so much for your generosity today with your time and sharing your story, as well as getting us thinking about questions of intersectionality and questions of stigma. These are some really, really big concepts that I'm sure everyone's going to want to have some time to think over. So I want to thank you again so much, and thank also our audience for joining us today. And we will see you next time on Let's Talk About Health.